Psychosocial Integrity Psych NCLEX Mental Health Concept. This number 3 video is going to challenge you. Grab a pen and paper. By the end of this video, you'll be confident answering psychosocial questions on the NCLEX. Are you ready? Score above 88 and just put it in your comment section. Let me know. Let's go. First question. It's not a trap. It is what it is. This is the way they will set it. You have to understand how to use it, not to get trapped. Which statement by the client demonstrate loose association? These are part of schizophrenia, thought disimpairment. You have to know what it means. Sometimes they will give you the statement, and then you have to ask yourself, what does this mean? Is this tangential, waxy flexibility, or loose association? Or now I've given you what is loose association, and you have to look at the statement and tell me. And this is assessing the client with schizophrenia. Which statement by the client demonstrate loose association? I like oranges because trains run fast and my shoes are blue. What do you think? The voices are telling me not to trust anyone. The nurses are trying to poison my food. I feel sad because my family rarely visits me. Which one shows loose association? Pause, answer. Keep track of your record. 88. Anything above 80, you're doing good. What do you think? Of course, one is obvious. There's no association between orange, train, and shoe, and blue, right? Voices are telling me not to trust anyone. Delusional, right? The nurses are trying to poison me. There's some hallucination in number 2 and some form of delusion. And here is a thing, persecutory delusion, worry about things. I feel sad, some depressive symptoms, negative symptoms. One is straightforward. I don't know what this orange attitude with trains and moving fast and your shoe is blue. Loose association. There's no connection between those two words. You're shifting from orange to trains and then shoes. There's nothing there. Straightforward, right? This is the way you answer them. Don't overthink it. If you overthink it, then you know you're doing something wrong. Which statement by the client indicate the presence of positive symptoms? Schizophrenia patient. Which one positive? And this is assessing a client with schizophrenia who is being admitted during psychiatric crisis. Which one? The television is sending me secret messages directly to me. That's what he said. I do not feel motivated to get out of bed anymore. I avoid talking to other people most of the time. I have difficulty expressing my emotions. And I rarely participate in activities I once enjoyed. Which one indicate positive symptoms? The best way to answer the choice, define the buzzword, which is what? Positive symptoms. If you know that, all the statements you evaluate it in terms of positive symptoms. Keep track of your record. Stop the video, put your answer in the comment section. Select and apply. You don't have to over-select. But I can tell you, television talking to me, that's disorganized thought process, positive. Me, I do not feel motivated to get out of bed, going down, depressive. Avoid talking to other people most of the time, depressive mood, social isolation. I have difficulty expressing my emotion, depressive mood. I rarely participate in activities I enjoy, depressive mood. One question, one answer. Over-select, you get 0. Did you get that? I try to make the answer choice a little bit better for you, but you got to understand what is positive and negative symptoms and which one. So certain things are positive, like delusion, disorganized thoughts, bizarre behavior. The rest are all negative symptoms. Which activity should the nurse include in the plan of care? Select apply. A nurse is caring for a client who has schizophrenia, experiencing social withdrawal, moving away from people. How can you get them together? Walk with one another client in the hallway. Remember, patient is schizophrenic. Participating in the card game with all unit staff members. Attending a crowded social gathering in the other day room. Completing an art project with one staff member. Engaging in competitive team sports activities. There is some theme in the answer choice. As you read, your brain tells you, hey, what? They're trying to trap me. But they're giving you the clue that, hey, stay away from certain answers. Pick your answer, and I will show you the trick. What do you think? Test-taking strategy is the best way to answer questions on the NCLEX. You will know the concept, but when you read the answer choice, I want you to be vigilant and use your buzzwords. You pick your answer? The key is what? Patient social withdrawal. Schizophrenia patient, when they come to the hospital, one-on-one, you and the nurse. Avoid too many people because then you worsen the situation. Well, social withdrawal, getting away from people, you can still get in towards people, but not everybody. That's the key. Working with one other client is good, one person. Participating with the card game, okay, how many? All staff members, wrong answer. Attending a crowded social gathering, well, wrong answer, too many people. Completing an art project with what? One staff member, I like it, one person. Engaging in competitive team sports, they have to be a bunch of people. Ignore it. So A and D are your right answer. But you can see the theme in the answer choice. That's the way I want you to think about it. And then she's preparing to admit the client with grandiose delusion, raising him or herself up, right? Which intervention should the nurse include the plan of care? Like I say, Psychosocial Integrity Psych and mental health question. When they ask you, attack the diagnosis, attack them. I don't mean abuse them, but attack it. Whatever you intervene, you make sure you address the definition. Grandiose delusion. What patient is delusion? Do you want to fight them? No way, right? They have grandiose, they elevate themselves. Fine. Bring them to reality. Don't argue. Don't accept what they're saying, but you don't say, I don't accept it. That's how you answer the question. So pick your answer choice. I've given you a clue because this is a hard one. Number one, reinforce. There's words that I will use to distract you. Reinforce the client delusion belief to build trust. Present reality statement during interaction. Correct the client what? Delusion belief in the what? Calm but assertive manner, right? Engage the client in lengthy debate about their delusion. Invite the client to elaborate on the delusion, right? What do you want to do? Which one would you pick? Which one do you think we should include in the plan of care in a patient with a grandiose delusion? This is psychosocial integrity for the NCLEX review. Which one? You pick your answer? Like I said, as I give you the question, I review the concept with you together. If you reinforce the client delusion belief, that's like your worsening situation. Don't reinforcement. You bring that to reality. Present reality to the statement they're saying. I don't see this. I don't see anything. I know you see them, but this is what I see. Correct the client. If you correct a delusion patient, well, you'll be there forever. Don't correct them. Even though I put assertive manner, it's a trap. No matter how assertive you are to try to correct them, you will just fighting a dead-end game. Engage the client in the lengthy. It's the same thing. Lengthy discussion about your delusion, ignore it. Invite the client to elaborate. Where when he's elaborating, you engaging in the lengthy discussion about the delusion. Only one answer. Add question by design to teach you so that next time when you see it on the NCLEX, you don't fall for it. Number 4, let me know what your answer choice was before I reveal it. Which statement by the client is appropriate? A nurse is providing teaching to a client with obsessive compulsive disorder who engage in excessive handwashing about the thought-stopping technique. There's the thought-stopping technique we use for obsessive compulsive disorder. Like I said, psychosocial integrity for psych nursing, attack it. It says stop thought. So the answer choice, you say stop your thought. Say the word stop aloud when obsessive thought begin. Do you see the clue? Avoid discussing the obsessive thought with what? Everyone. Increase hand washing gradually to reduce your anxiety. Punish yourself each time the compulsive behavior occurs. Which one is consistent with the thought stop technique when you have obsessive compulsive disorder? I can tell you, A is the right answer. When you see that you're about to get into your thought process, you got to do something to distract you. Any stimuli, smile, laugh, say something weird to distract you, or pinch yourself, something, but that is not punishment. This is where the thing comes. You can put a rubber band on your wrist and slap your rubber band to remind you, hey, this is what you're going to do. You start going to think about washing your hands or engaging. So stop your thought, break the cycle and stop. Avoid discussing it. It's not stop thought and your thought. Increasing hand washing gradually, yeah, that's off. And this is caring for a client who states, there is no reason for me to live anymore, suicidal, right? Which respond by the nurse is appropriate. You should not feel the way that way. Are you thinking about hurting yourself? Your family will be very upset. Let's talk about something positive, therapeutic communication. You know the right answer. Assess for suicide. About to hurt yourself? And this is caring for a client experiencing who has schizophrenia, who says what? The FBI implanted a chip in my brain. FBI implanted a chip in my brain. That's schizophrenia patient. That which respond by the nurse is appropriate. The patient is worried. There's some chip in the brain. They're reading my mind. This is not true. Do you tell them that way? Why do you believe that? That is what this answer choice is based on the misconception and the concept the anchors will distract you. They're not going to use the same words, but they will describe it the same way. I do not see evidence of that, but I understand this feels rare to you. Do you think this is a good answer? It's so long. You should stop thinking about that. What do you think? Which one is the best answer choice to address the patient therapeutically? Of course, bring them to reality. That's what it means. I do not see that. That's what you saw. But me, hey, I understand you feel very bad. We'll figure it out, but not that. This is not true. How do you know? Why do you do what? Why do you believe that? Well, patient believe that. You can't fight the belief. And this is caring for a client with mania who has intrusive and disruptive behavior during group therapy. Is distracting your class. What would you do? Which intervention should the nurse implement? Encourage competitive activity because they have too much energy. They're disturbing you. Said, well, do exercise. Set clear behavioral limits. You said, this is how far we can go. You're just disrupting. You got to be assertive. Place the client in the seclusion. Just put them in seclusion right away. And then allow unrestricted physical activity. Which one? Of course, we got to set limits. We don't argue with them. We tell them we are the boss and prevent them from hunting us. The last two questions. And this is caring for a client with obsessive compulsive disorder who spend hours washing their hands. That's the ritual. Which intervention is the most therapeutic? Tell the client to stop the behavior immediately. You are the boss. Allow enough time for the ritual to initially, when they are in the hospital, prevent all compulsive behavior at once, right away. Remove the client from the bathroom because they're washing their hands. They're going to cause break and have infection. What do you think? Which one is reasonable and which one is all based on concept? Don't pick a reasonable answer. Pick an answer based on concept regarding that condition. You pick your answer. Well, give them time and slowly wean them off. You can't stop the behavior right away. You don't go all or none. Slowly, 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 and you can get it. Last question. What is your score? Post-traumatic stress disorder. And this is caring for a client with post-traumatic stress disorder who suddenly become what? Anxious about hearing fireworks outside. All of a sudden, boom, I'm worried, fireworks, because I thought I've had experience before. Will respond by the nurse is most appropriate. Those sounds cannot hurt you. Don't worry. They're not going to hurt you. You need to ignore the memories. Don't forget about them. You are safe right now. Safe right now. I'm providing safety. The nurses may remind you of something, but right now you're safe. Nothing is happening. Try not to think about the event. Which answer choice? You see, there's one answer choice saying something different. The rest is saying the same thing. You know, you see it? You pick it? Put down in the comment. Let me know. What do you think? Number C is your right answer. Safety, safety, safety. And I'm here with you. I'm supporting you. I care about you. Whatever you're experiencing, we're here for you. Therapeutic intervention. NCLEX Psychosocial Integrity. Take care of yourself. Thank you for watching. If this video helped you, just put a small comment. so that we can grow this channel. Take care of yourself. Bye.